Hello, my name is Mark Gonzalez, and I'm Chair of Orthopedics at the University of Illinois at Chicago. I would like to welcome you to our department and our university. All of you are to be congratulated for progressing so far in your career. We've had over 800 applicants, and the fact that you are here today attests to just how academically outstanding you are. Chicago is a cosmopolitan city and a great place to train. We have great museums, restaurants, and sports teams. We are a large residency, the largest in the city of Chicago. We rotate through 5 hospitals to provide you with a significant breadth of experience. We have a good clinical experience, do a lot of research, and treat a lot of patients. But I first want to talk to you about why I believe our program is unique. When Dr. Al Mejia, our program director, and I took over the program 13 years ago, we decided that we would focus on resident education. We have virtually no fellows in our program. Our department, in a word, is about the residents. We are committed to teaching residents. As educators, we consider the residents to be the consumer. They are also stakeholders in our program, and we consider them and seek their input in decision making. We have a very balanced program. Residents spend time in clinic and in the operating room theater. Although you may not spend as much time in the operating room as in some residencies, when you are in the operating room, your experience will be maximized as you will be performing the surgery. In clinic, you will learn pre-op and post-operative management to learn how to deal with complications as well as with unhappy patients. You will get a great mix of surgery, clinic, and research. Our residents are skilled technically and in fellowship can hit the ground running. This is why our residents get great fellowships and why once one of our residents is accepted into a fellowship, subsequent residents are also invited. Our residents apply for fellowships in all orthopedic subspecialties and are accepted into some of the most prestigious fellowships nationally. The good balance in the program also engenders good decision making in our residents. Residents learn to work together as a team. The residents are well supported. Why are the residents comfortable? Our mantra is mutual respect. Early on, a resident's duty is well defined. Those who do not carry the load are tutored proactively. Early on, everyone learns their part and learns to carry their share of the load. The residents know that when they are not on call, their patients will be cared for as if they were. Our residents learn to be dependable team players. These skills translate to success in practice. The sense of fairness creates an excellent environment for learning. We have a strong sense of democracy and governance in our department. We believe that all stakeholders should have input into a decision. We always seek resident input and how we can make things better and do not make changes without their input. We are a diverse program. We are continuously trying to cast a wide net to recruit talented individuals. We encourage diversity and believe that this is an education unto itself. At our program, you will get a great education. We have conferences on sports and total joints on Monday morning and a hand conference Friday morning. On Wednesdays, we have dedicated teaching from 6 to 11 a.m. We have a hands-on skills lab every 4th Wednesday morning. We set high expectations for our residents. We want all of our residents to graduate from the program with an outstanding fund of knowledge. Our residents are expected to do well in the in-training exam. In 2018, we scored in the 91st percentile among American residencies and the 92nd percentile among all residencies. We scored above the 72nd percentile last year. Our residents are required to do a research project prior to graduation. We have a biomechanics laboratory headed by Dr. Fareed Amarouche and a nerve regeneration laboratory headed by Dr. James Kearns. Dr. Maria Simenow, who headed the team that did the first face transplant, runs a microsurgical laboratory and is involved in nerve regeneration, immunology, and vascularized tissue transfer. We also have 2 research fellows in our department who participate in multiple research projects involving clinical studies in total joint arthroplasty and access issues in orthopedic care. We believe that research is an important part of your education because as an orthopedic surgeon, you will read numerous research studies offering new treatments for your patients. You will have to evaluate these studies to decide if these studies were meaningful and if the conclusions are valid. Having been involved in research, you will have much insight into how studies are constructed and how to evaluate their validity. Finally, as you proceed on your interviews, you are determining your career path. My advice to you is to always do sufficient information gathering to get the data you need to make an informed decision. We are very proud of our program and encourage you to ask questions. In the time you spend with us, I want you to get a feel for our program and an understanding of how we do things and how we work. Please ask questions. Thank you again for applying to our program. I look forward to meeting you.